Hi, everyone. Today, I'm super excited to talk here with Dr. Guido in the best stage of your treatment that is will be when the implants are already integrated and you're ready for your final zirconia restoration in your full arch treatment, the second stage, Doc? So basically, Dr. Guido is going to be our main doctor responsibly of this treatment, be the guy that will be with you the whole week and a half until you have your dream smile. And Doc, why do you feel that nowadays zirconia is the best type of material for these restorations? We're going to talk a little about temporaries, the ways of temporary that we do, the acrylic with the metal bar frame, nowadays the 3D printed resin. But let's focus more on the second stage. So comparing to the old metal acrylics that was done as a final restoration 10, 15 years ago, the metal ceramic, what are the benefits that we can have with zirconia?
Dr. Ferb, first of all, thank you for having me today.
Pleasure, man.
All right, so let's get to it. Why zirconia? Zirconia is now probably the best ceramic, the hardest ceramic we have in dentistry right now. Yeah. It's a material that obviously started with some limitations, but has come along through the years to be one of, if not the best restorative material for full arches, right? We used to do like full arches with a titanium bar in an acrylic wraparound.
What are the things that you didn't like about it as a final?
First of all, the acrylic wasn't meant to be a material used for fixed restorations.
Or to resist so much force because, they were used for dentures.
Exactly for that reason, right? So you have a denture that is movable. I mean, it has a little bit of give to it. It's seated on your gum tissue, so when you bite on it shifts a little bit. Exactly. That prevents it from breaking for the most part.
Or chipping the teeth.
Exactly. But when you place it on a fixed solution, it can have some issues. Teeth break, they chip, they snap off. It's very common.
And that's important because the patients have the expectation that with that they will be able to eat whatever they want. And that was the limitation of material that we have in that moment. Also the hygiene. It was thick materials, a thick restoration. They have a lot of food impaction. Even 30 years ago, the famous high water restoration. So the patient even talk and, saliva, food, everything was super uncomfortable. And then if they don't were able to have acrylic, you offer them metal ceramic. But also metal ceramic have their issues, right?
Yes. I mean, we have seen a lot of metal ceramic restorations coming through our clinic that have already the ceramic chipped or broken or with some issues. Obviously, the underlying metal understructure, most of the time it doesn't have like any significant damage to it, but the ceramic always comes in broken.
And this, guys, is important because nowadays, with all the technology of osseointegration that we have in dental implants, the challenge is not that you have the implants integrated in your bone, is to give you a restoration that will work as you expect, 15, 20, 25 years, trouble-free. So zirconia give us the chance of having, for me, better aesthetic, because the anatomies that the milling machines give, of course, are much better than handmade metal ceramics. Strength, translucence, and time. And in dental tourism, being time effect is a must.
It's critical.
So that's why our dental lab have been evolving every single day to perform more than full zirconia restorations. But let's first talk a little about what a patient can expect on this second stage when they come for their final second stage. Okay. What is the first appointment, Doc?
Okay, first appointment, we actually take new x-rays of the patient, so just to verify that all the implants look good or what to expect, right? Sometimes we have to see if, for example, one implant may be lost, and if we have another implant that was not loaded, underneath the gum tissue, and we can now use
Yeah,
it.
basically know how many implants you have for the final restoration. If you need to discover if one implant failed or something, to be sure if you're gonna have 7, 6, 5, 4 implants for your final restoration, and talk all the chances of restoration that you can offer to the patient, right? Okay, then that you take that X-ray and you know how many implants are fine or what type of final restoration. What is next? You know, because that's 10, 15 minutes. You know,
yes.
Well, we just talked.
So next we start taking records by registration. We are actually open up the access holes for the screws. We unscrew the temporaries, and we check every implant. It's good. If all of them are good, then we start taking impressions.
Okay, and tell me a little about that impressions. You know, because we have been working in dental implants for almost 20 years, 18, 16 years. And look, trust me, any doctor that has been working in full arch, they know the challenge that is taking impressions. What are the benefits that you have feel now that we have photogrammetry, or that we have a doctor just for us to be scanning? You know, we just call Joshua and Joshua comes and starts scanning. What are that things?
Let me tell you something. Actually, today I had a patient that I took off the prosthetics, just checked that all of the implants were good, since we are using now Noble Biker, so all of them integrated flawlessly, and actually didn't have to take any impressions.
Yeah, we have all the info already.
They were already taken from the first.
That's the benefit and the blessing of digital dentistry. You know, having that technology for our patients is just an experience. Okay, you take the impressions. Then sometimes the patient, he will not have temporaries, right? Some days, sometimes he will keep the temporaries. So usually what? The patient will not have the temporaries for a day, 2 days, something like that, right?
Yes,
because we need to have records.
Yeah, normally if we don't have a complete digital workflow, we are gonna need to take new impressions.
Okay,
right?
but with the new technologies, the new patients that are having these full arches, they will not have that problem, right?
Yes, no, I mean, if you have a complete digital workflow, actually, we just check the implants and they go home with the fixed temporaries again.
All right, so the patients can expect that's going to be the first day, you know, taking x-rays, check how are the implants, and take impressions. Now, there's going to be the first and most important chat that they will have with you. Doctor, and what type of restoration are you going to give to me? What I'm going to tell you, what I tell to the patients, it's not the type of restoration, is that your main goal is to have a final full zirconia restoration. What type of restoration, depending on your bone structure and how many implants you will have. So, Doc, tell me a little about the difference of an all-on-6, 3-on-6, or even our newest way of doing a full arch with the metal bar frame with photogrammetry, just without pink, you know? So the patient can understand a little, oh, you know, but this guy have a 3-on-6, why do I have only an all-on-5, and why do I have pink material and this guy is not having pink? Because patients talk, you know, I know the patients usually they are sometimes in the same hotel, or they become friends because they see in the office, and sometimes it's challenging for us as a doctor to explain them that it's not the same teeth for every single patient.
Yeah, well, this is not a cooking recipe, right? So sometimes patients may have some arrangement of their implants. That the thing is that the 3-on-6 is very sensitive to the placement of the implants, where are they placed, and the amount of implants you have.
And the 3-on-6 we developed and we used it many years ago, like 4 or 5 years ago, more, because in the past it was or making 3 single bridges or making a thick full bridge of zirconia, because in the past we were not able to make a zirconia full arch with a metal structure. So the thickness of that zirconia need to be big, so the zirconia can resist. Nowadays, we have different technologies that can give to the patient the same comfort as a 3-on-6, having the benefit of having a full arch supported by metal. For you as a doctor that have been restoring many full arches, what is the piece or what is the level of confidence that give you a full arch having a support metal structure?
I mean, it's completely another thing. I mean, for example, having a full zirconia arch. Okay, so
Yeah, we
you're
don't-
torquing that thing down and you're praying it doesn't break, right?
It's
a
the
lot
first.
of times because zirconia doesn't have the ability to absorb.
Yeah, because sometimes patients, they need to understand, yeah, zirconia is a strong material, but it's very technique sensitive. You know, if one of the screws get loose through the time and the zirconia have a little micro movement, that micro movement can make their zirconia
can
break.
make it break.
Okay,
Yes.
the passive level that you need full arch zirconia is also a lot of technique sensitive. Having a metal structure, what will help us is to have less complications through the years, and that's the goal for these restorations, that you can use it 15, 20, 25 years trouble-free. And having the metal structure is the way. Now,
Yes.
what's happening then? Nowadays, we have ICAM photogrammetry, and with that, we can have more precision. We have an amazing digital designer in our office that she's able to join a metal structure with a zirconia, and then you know all those benefits. Okay, for example, what are the cares that you tell to a patient when they already have their zirconia restoration?
Okay, so basically, I tell them you have to take care of them as if they were things that you wouldn't do with your normal teeth as well. So be careful of bones. I know some people like to gnaw on bones, like for example, chicken wings, stuff like that. So avoid that type of food, or avoid at least bones chewing on ice. Some people like to do that. For the most part, I mean, zirconia can withstand a lot of load, but you have to be careful of the seeds or pits or stuff like that, all right? Also, I'll tell patients that they have to keep them clean. Zirconia is a very crystalline material, so it's hard for things to stick to it.
But what is to have it clean? Do they need to brush? Do they need to use a
Brush them like
mouthwash,
normal.
water pick?
Yeah, brush them like normal, so you would with a soft bristle brush. Avoid any toothpaste that have like abrasives or additives added to it. I also tell patients water pick is a most, right? If you have a full arch solution in your mouth, it's a very good solution. It's a prosthetic solution. It's not your real teeth. Okay.
Yeah, and there's another important question that many patients ask us. You know, doc, I don't want that fake smile. Okay, don't give me that goofy smile. I have seen patients that, you know, they're the teeth like this size. What are our protocols so the patient can be calm, that they will have a smile that will adapt to his face, to her face, that will look natural? What are all the protocols that you do? What is the communication that you have with our dental lab ceramists and designers? And also, what is the relationship that our patient can have, doctor, dental technician, to have a personalized smile?
All right. So the first thing, we take pictures, right? With the temporaries, we put our patients give us a smile, right? When we take a standardized picture that we have in the lab, and the technician actually looks at that picture and starts designing a prototype of the finals. Okay, prototype of the final zirconia. So that prototype, actually, we do a trying of that prototype before we start manufacturing the zirconia.
Of what material is that?
It's a 3D printed resin. Okay, so a lot of people find it funny because the color of the resin is kind of bluish gray, and they all start making jokes about Halloween and whatnot, right? But yeah, I mean, actually, even by design, we have kept that bluish gray resin
to see contrast.
because people we see contrast, and people tend to focus too much on the color.
Exactly.
Okay? So we did for a time like the white 3D printer resin, and they were like, "Hey, it's too white, it's too white." No, the 3D printer resin trying for me to check the function and
The
for
proportion of the
patients
teeth,
yes.
how much teeth you choose, the fit of the structure, if it's gonna be fine, the bite, all those little details we need. You know, it's like when they present you a render of a house. You need to check first how it's going to be the house before they start building it. Okay, so we present you the render of your smile So you can ask for any modification. And also sometimes even patients, they go and they talk with our designer. I want these teeth in this
It's
this
very
way.
common for me to call her into the dental chair and have her actually look at them. I mean, so I put the Michelle is the name of our designer. I put her in front of the patient, and I have the patient smile, and I start telling her, look at this, change this, please, and she actually looks at the patient.
Okay, and also important things, for example, all of our cases, we use multi-units from Novel Biocare, the originals. So the patients, the loosening of the multi-unit is almost zero. Another thing, we have been making the restorative of many brands, but having Novel Biocare have been a game changing for us on the fit of the final structures. What are the things that you feel that we do in our office that separate us for other clinics that they do full arch restorations? For example, I will give you one: temporaries with metal bar frame. Your temporary will not break in two. It's easier that you can nowadays make a temporary of full 3D printed resin in 24 hours. But look, you're a medical tourism patient. You're going to be a 1 week here. Let's personalize your temporary as much as we can, and let's make the strongest temporary that we can give to you, so you can be more calm that when you go back to the States, you will not have any big catastrophic complication.
Well, actually, it's because we have design protocols for the clinic, right? So what you just said, I mean, having a metal understructure on a temporary, a lot of people don't do it. But something breaks, then what happens? Implants start getting loose. You have to go through surgery again just for that.
Nowadays, what is our protocol in full zirconia arches?
Okay.
Nowadays, also, we don't do only just zirconia, right? Maybe you can explain a little.
Okay, full zirconia overstructure and a metal understructure. Why is that? The thing is, as we were discussing a little bit ago, the zirconia doesn't have a lot of give. I mean, even if you have
tolerance,
the resistance to breakage is low. It has a lot of it can withstand a lot of load compression, but it's not good under tension, right? So metal, on the other hand, is the best of both worlds, but it's not. I mean, it's doesn't look good, right?
Yeah, but in the moment that we put the metal structure and over the metal structure the zirconia, we have the benefit of the aesthetic of the zirconia, but the flexural strength of the metal structure. So at the end, you will have the best of the two worlds, You will have the resistance of the old metal ceramic with the aesthetic of the new zirconia. And that's why now that's our protocol. Another things that happened in the past, I know any doctor that do dental tourism and tell you that this never happened, or he's lying, or he don't see patients, It's Friday afternoon, the patient goes back to his home, and Saturday, the structure is not fitting, right?
Yeah.
What is the technology that nowadays we have in our office that that you arrive on Friday and everything is already checked, and you just go and see the structures?
Organometry, for one thing. Yes, I mean, it gives us a very, very exact fitting of the structures to the implants.
And the try-ins of the 3D printed resin,
3D printed resin actually gives us, the photogrammetry is for the fitting of the structure over the implants. And the 3D printed resin actually gives us the look and the function. We verified that the patient is not going to bite and there's one side open and you have to start grinding a lot of.
And that brings me also to the importance for us as a restorative dentist of having the dental lab in-house. I don't understand how a dental office will do dental tourism without having an in-house dental lab.
Definitely.
The amount of things that can happen in that last appointment. Doctor, I want to change the color. Doctor, I want my teeth a little longer. Doc, can you shave this tooth? A little change in the bite. Some abutment have an issue. Okay, there are so many things that you need to have the expertise of how to solve it, but if you don't have the persons right next to you to solve it immediately, this will give at the end a super bad experience to the patient, So tell me a little, of the importance for you of having that dental lab next to you.
It's vital. It's completely vital. I mean, as you said, Friday afternoon, patient goes home Saturday morning, right? And that's something is not fitting. You know you can solve it, but you need to add a little bit of ceramic here and there to it. I'm not a ceramist. I mean, if I didn't have the lab right
you
there,
will need to call your lab.
we would have
a messenger
to call the
will.
lab. Hey guys, I
Come
know
here.
it's Friday afternoon, but please stay on the lab.
They have many clinics, although you're not going to be the
it's
priority
crazy.
of them. Yeah, it's
Completely
super
crazy,
complicated. And at the end, guys, also I want to tell you a little about warranties in our office. You know, we give 5 years warranty no matter what of your zirconia. And basically, also another warranty is that we are going to give you just the best materials. Okay, having dental tourism for us is such an honor that you choose our office, because we will guarantee you that you will have the best implants, the best zirconia, and the best techniques in your mouth. So, Dr. Guido, thank you for being with me in this podcast, explaining for me the happiest stage of all the full arch treatments, that is when they come for the smile that they have dreamed. And hopefully you guys have been clear a lot of doubts with this podcast. Okay,
Thank you
Doc.
for having me.